Hey guys, it's Dr. Storm Shannon here with StormShannon.com. In this video, I wanted to go over a simple exercise for spinal movement in the upper back, the thoracic region. So I want to think about this a little bit differently than what we do a lot of times everywhere else. So, the curve in the upper back, the thoracics, is the opposite of what we have in the neck and in the low back. So a lot of times when we're talking about people's postures, a lot of people, we focus on the excessive curve a lot of people have in their lower back and working on strengthening glutes, lower abs, stretching hip flexors, things of that nature, lower cross syndrome stuff to bring this back into alignment. We talk about with the neck, with the an excessive curve and a forward head there on stretching some of the posterior muscles on the back of the neck, strengthening some of the small muscles in the front of the neck. But we don't talk a lot about the thoracic spine. A lot of times there's a lot of stuff we talk about with shoulder positioning, right? Opening those shoulders up because people are rounded forward sitting at computers and stretching and opening that up. But for the upper back, we actually want a little bit of a curve in that upper back. So, what we want to work on is actually moving and mobilizing that and keeping that curve nice and stable. So an easy exercise to perform is either standing or sitting in this position as we're working on rounding through that spine and that upper back. So what I'm not doing is I'm not rolling my shoulders forward to create that, right? I'm not doing this. I'm pushing my spine back in that upper thoracic spine to open that up, and then we come back to neutral. I'm not going all the way into hyperextension, so I'm going neutral to flexion, neutral to flexion. Sometimes it helps to not roll your shoulders forward, is to hold them up so that as you roll then it comes from your upper back. So if you need to feel it there, do it this way, because sometimes here we have the tendency to do this. So whichever way works for you, either with the arms up, arms at the side, as long as you can feel that flexion into that upper back, that's what we're looking for. The way I like to have people do a lot of things is do a little bit of an isometric hold, kind of open that up. So holding for 5 to 10 seconds, relaxing, doing 5 or 10 reps of that. Make sure you're breathing the whole time. So try that out, especially if you're having upper back and neck issues, even if you have low back issues. Keeping the spine moving and properly aligned is going to help the whole system. So try that out.